I'm Kate.
I'm Beverly.
And I'm Sonia.
And today we're dishing with you from Oyamel, located at 401 7th Street Northwest. We're in the Chinatown area, but we're getting really Mexican because this is a Mexican small plate.
Latin
tacos and guacamole, which I'm going to
margaritas.
Margaritas. I have a pomegranate one.
And cheers. I'm not sure what's in this one, but it's really good.
I have like a pisco sour, which I had a little bit beforehand, and it is pisco sour. Well, today we are going to be dishing with our guest, Dr. Claudia Cotca. Say it for me.
Cotca.
Cotca. You'd think with a last name like mine, I'd be able to say other people's last names. Now, Claudia is a dentist, a DDS, but you really focus on many other things other than just the dental cleaning, which I think we all think, oh, it's 6 months, I need to go and get my teeth cleaned, check I don't have cavities. But you do so much more in terms of cancer, and also, what else? What else do you exactly do?
So let's start with the oral cancer. So oral cancer screening is very important to have, and it's usually done at the comprehensive examination stage.
No, you say that, but I've never had this done before I met you. So you're supposed to have it done every time you go in for a cleaning?
You should be having that done at least every 6 months.
Would we know if we're having it done? I mean, what does it feel like, and what are you really doing? Because when my dentist looks, it's sort of like a horse. I feel like a horse. But should they be prodding and stuff?
My dentist grabs my tongue and looks up and feels underneath my neck.
Exactly. So you do palpation test and you look at if there's any sort of nodules and any changes as far as tissue changes or any particular color changes within your mouth, as well as surrounding tissues like the borders of your lips, for instance. So oftentimes if a patient is wearing lipstick, which is fantastic for ladies, we need to remove that because I like to take a look at your borders to make sure that it's regular. Especially looking behind the ears here is a very sensitive area, or even this might pipe out. Now,
behind the ears for a dentist? Yeah, tell us about that.
It's just a very, very sensitive area back there. So, basically look at head and neck, and we feel for any type of nodules or irregularities, and we go from there.
So who knew? A dental screening, your 6-month checkup, is so much more than just looking at the teeth and cleaning the teeth.
Exactly.
We do have busy lives in Washington, and everyone's always looking for a dentist, a recommendation to go. And some people skip 6 months and go once a year because we do have such busy lives. Is that normal? Would you suggest that? Obviously not. You want us to come once a year. But when you have busy lives, what do you do?
Well, this is what I say. Back to the oral cancer thing. Every hour, one person in the United States is diagnosed with oral cancer.
Really? Every hour?
Every hour. So NIH has done a study in 2007, and they found that 66% of oral cancers are diagnosed in late stages. Now, the staggering 44% that are diagnosed in early stages, only 50% of those particular cases have a 95% rate at a 5-year mark survival.
Wow.
What are the symptoms? What should you be looking for at home between your dental visits?
Right, and so that's a good conversation to start with your dentist and basically say any type of nodules that may be coming up, if after 2 weeks it's still there, and oftentimes I may say to a patient, okay, I see something irregular here, I'd like to see you back in 2 weeks. And if it's still there in 2 weeks, we're going to have to either send you to a specialist or do a biopsy or some sort of follow-up to understand where that comes from. So going back to your original question, if you're going to subscribe to going to the dentist whenever you like, really having the 6-month check gives you the opportunity to be thoroughly checked so that early diagnosis occurs, especially in oral cancer.
No, I think when most people think about oral cancer, they think, I'm not a smoker, I don't use chewing tobacco. So should I be worried about oral cancer? And if we haven't had it in our family, what sort of things should be worried about doing?
Right.
Yeah, what brings it on, too?
Yeah, I use this lipstick sealant thing that burns, and I keep thinking to myself, I love my lipstick sealant, but it may be causing cancer. Should I be worried about cosmetics?
Well, this is the situation. With oral cancer, you really want to be very, very careful because sometimes the symptoms are not there, and that is why visual screening is very, very important. As far as what causes oral cancer correlations. Now, it's funny because a lot of the cases that actually have oral cancers do not smoke, they do not chew tobacco, they're not at risk for anything else. recent studies have actually shown that there might be a correlation between HPV and oral cancer. Now they have gone back. Now they have gone back to retrospectively look at those particular studies, and so the results are still coming up on that. But that's something to look for. Now, also epidemiologically, in the last 4 decades or 3 decades, the rates of oral cancers have not gone down. They have maintained.
Even though you're checking them every 6 months?
Exactly. Now, of course, the thing is, we want to see what the studies that include the HPV correlation will translate into in the future. But there might be suspicion that oral cancer might be increasing. So therefore, we have to be very, very careful. And oftentimes, I may even say to a patient, because of your risk factor, like if it's an HPV status, especially high risk HPV, I may increase their frequency.
I was just about to say, most of us think, okay, going twice a year, that's enough, but maybe you should think about upping that if you're at risk.
Well, if you're at risk, that might be the indication. And listen to your provider, your dentist. If they recommend 3 or 4 month recalls, that means every 3 or 4 months you should come for a check, a cleaning. There's very good reason why that recommendation is made.
Now you're getting into some other healthcare concerns other than just, getting your teeth cleaned and things like that. We've just had a pretty wide sweeping healthcare, nationwide conversation. As someone in the industry, how do you feel about this?
Well, dental plans are a little bit different than medical plans, right? So, but as far as the dental healthcare, I would say, it's a little bit, the dental technologies will actually have advanced quite rapidly. And there's been some interesting things which I should probably mention for you and the audience. One is lasers and the other is porcelain. And so each has added a nuance of benefits and advantages, which, like for instance, the lasers add a nuance of sterilization factor, which really increases the healing potential. So that's really exciting to give to the patient as a provider, meaning that it won't take perhaps as long to heal, and the results are obviously translating to better success.
But we're telling everyone that it's mandatory that you have health care coverage. Should it be mandatory that everyone have dental coverage too? Do they go hand in hand?
Well, if you often want to do that, of course. The oral cavity is part of your body, and of course, in the oral cavity, a lot of systemic diseases and conditions actually have manifestations in the oral cavity. So, for instance, diabetes has many oral health complications, or other systemic conditions also have oral health complications.
So going back to what I said about feeling like a horse, much like when you check the health of a horse by looking at its teeth, we're the same thing. It's the same thing for human beings.
It is, you're right. The mouth spells so many different nuances about your systemic conditions, and all really are interconnected, and they're interdependent as well.
Well, Dr. Cotca, we've learned so much from you, actually, so much about dental care that I never knew.
I know, I just keep touching my teeth inside my mouth. Like,
you're going to worry about our smile. But if you don't have a dentist yet and you're looking for one, we can give a great recommendation, or be in touch with Dr. Cotca to find out more about oral cancers
and keep flossing.
Whitening your teeth.
Exactly.
I bet you tell everybody floss, 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 right?
And it's also when you floss.
Come back and check us out here next time on The Distant Dish.